Thank you so much for taking the time to attend. We're just going to walk you through a little presentation we prepared for medical professionals here. We just wanted to walk you through what the chronic pain scenario out there currently is like, and what current therapies are out there, what their level of efficacy is, and where the ActiPatch comes in, how it compares to other technologies, etc. We're also going to cover specifically how ActiPatch works and why we believe existing technologies are not very effective. And with that, we'll also finish off with how you can use the ActiPatch to prescribe it to your patients. And any other questions you might have. So with that said, let's get started. All right. So just introducing ourselves, the speaker, that's me, I'm Sree, and I work in product development BioElectronics, and joining us also is Rawe. He is the clinical research director. My background is in that I'm a biomedical engineer, and I did my dissertation work on developing these electrical devices for pain relief and other technologies. And Ian, he has a background in biophysics and worked primarily in wound healing, and he has plenty of clinical experience too. He organizes clinical studies and essentially future applications of the ActiPatch. So any questions that you might have, he'd be more than happy to answer towards the end. All right. So just, I understand you are all healthcare professionals, but just a little walkthrough of how the demographics of pain are. I mean, in a classic sense, the definition of chronic pain is that it's pain that persists, it's pain that does not go away. Normal acute pain, you injure yourself after a day or maybe two or even shorter, it usually goes away. But when it doesn't, we define that as chronic pain. Quick numbers, there's about 1.5 billion people worldwide who actively report suffering from chronic pain, translates to about 1 in 3 Americans, and about 1 in 4 physician visits are actually for pain. Now, in the umbrella of chronic pain, about 80% of it is a result of musculoskeletal conditions. And these include something like joint pains, arthritis, issues of the spine like lower back pain, sprains from running, any repetitive injuries like plantar fasciitis and things like that. And I'm sure you all understand how pain has a significant impact on your patients' both social and economic quality of life. It is known to be the biggest detriment to quality of life. Now, drugs and TENS therapies which are currently out there have a limited effectiveness, and I just want to walk you through why that is the case. Now, let me take your attention a little bit towards the left-hand side. We can look at the graph later. Is that most over-the-counter analgesic pills, they try to block pain, and in some cases they try to reduce inflammation. Now, in terms of acute pain, there's inflammation, and taking an ibuprofen might help. But with chronic pain, often there's not necessarily active inflammation going on. So these pills do not necessarily work. And in fact, long-term use is known to cause some serious side effects. So over-the-counter analgesics are not very effective for chronic pain. Now, there's some other alternatives like heat patches or ointments and other creams like that. And they provide temporary relief by masking the pain for as long as you're using it. So the analogy is, let's say you bump your hand against a wall. If you rub it, you feel better as long as you're rubbing it. But as soon as you stop, pain comes back. That's the analogy with these masking technologies. And part of the reason, we all hear this term, opioid crisis, opioid epidemic, and I just wanted to touch on that a little bit. And we understand that healthcare professionals go to opioids only as a last resort because existing therapies do not work. And in fact, it's the inefficacy of those therapies that drive new opioid prescriptions. On the right-hand side, I want you to show you the graph, essentially comparing the average amount of pain decrease for chronic pain for different therapies. You can see that NSAIDs and acetaminophen, they have about the same amount of pain decrease. Heat wraps do a little bit better. They decrease pain by an average of 20% or so. And interestingly, vitamin B12 is known to be the most effective therapy of all. I mean, the point I'm trying to make here is that if vitamin B12 is our most effective therapy, clearly we need to do something better about reducing people's pain. In fact, the CDC even accepts that non-pharmacological therapies and non-opioid therapies are preferred for chronic pain. So where does it leave us? Why are these ineffective? I just wanted to walk you through the background a little bit here. So let's look at the picture on the bottom, right? We have mainly nociceptors, which are painful pathways, and then there's mechanoreceptors, which are sensation of touch. Now, in a normal person, in a healthy person, when you activate the nociceptors, like you hit a pin or you touch fire, they fire up and you feel pain. That's reflected in the top part of the picture. On the bottom part, when let's say you touch the table or you rub, as this figure says, a feather, you perceive it as touch. Now, what happens is, for a person who's injured, a constant firing of these pain signals can sometimes overwhelm and oversensitize the nervous system, basically the afferents. And this leads to a condition known as central sensitization. Now, let me show you in the next figure what happens to individuals who experience central sensitization. If you look at the figure again, in the bottom, and in the top figure, for nociceptor inputs, it leads to exaggerated pain levels and what we recognize that as hyperalgesia. Now, in persons without central sensitization, normally mechanoreceptor touches should not lead to pain. But in this case, even small touches or slight movements can lead to allodynia, which is pain levels when there should not be any pain. In a sense, it's widely accepted in the pain community that nerve cells learn pain when they are repeatedly subject to these pain signals. And the hallmark of it is it results in amplified pain. The pain is unrelated to the pathology. For example, with knee osteoarthritis, we see that the level of pain people experience is not always related to the amount of underlying damage. And importantly, pain persists after healing, so even after the injury has healed. And so that sets the stage for chronic pain is often a result of some neurological issues, in this case, oversensitive nerves. Now, with that said, I want to introduce the concept of electroceuticals here. Electroceuticals being, I'm just going to walk you through what technology are out there. But essentially, an electroceutical is any therapy or any modality, any device that regulates afferent nerve activity for therapeutic benefit. I mean, the buzzword going around these days is it's called neuromodulation. In other words, when you regulate nerve activity, it does wonders. Now, the good thing about electroceuticals is it targets the underlying condition. Since we're talking about chronic pain as a neurological issue, why not address the neurological issue, right? And so we have some options here. Broadly, some invasive options and some non-invasive options. Invasive options like acupuncture or percutaneous electrical nerve stimulation, what they do there is they insert electrodes or needles that permeate through the skin and touch the nerves themselves. And then they apply electricity or just mechanical pressure to change the activity of the nerves. Another invasive option is, as we commonly all know, they're spinal cord stimulators. Now, invasive options are known to be effective in certain cases, but almost always the risk of post-surgical complications outweigh any benefits that they might get. Which brings us to the non-invasive options. There's two main categories of technologies out there for non-invasive options, and these are both over-the-counter, non-prescription. One is commonly TENS. You know, we see the Shaq O'Neal episode going on TV, and there's TENS, the icy hot patches, and other technologies such as that. And then what we have is our technology, which is the ActiPatch, the figure that you see in the bottom right of the slide right now. Now, these two technologies are non-invasive. However, and TENS has been around for probably 60, 70 years now. But the main difference, I just want to walk you through in the next slide. The main difference is that ActiPatch is sensation-free, I mean paresthesia-free, and it can be used for an extended period of time, unlike a TENS device, which you can't use for more than 20 or 25 minutes if you want to avoid any skin injuries. And it belongs to a class of technologies that are known to result in neuromodulation. Now, what is the ActiPatch? If you look at the top left, that's the device itself. It's a very simple device. It consists of essentially an antenna, which is the wire, and then a little module, which has the electronics and battery. Now, the therapeutic area is actually, as you can see, the blue lines. That's obviously a dramatization. You don't really see anything. but it's the treatment area within the loop. You essentially turn a device on and it produces electromagnetic fields within that loop. So the area of pain has to be placed within the loop. That's the way it works. Now just a little comparison of ActiPatch versus two commonly known TENS devices and how it compares to analgesic pills. Importantly, the ActiPatch can be used 24/7, meaning you can actually wear it at night, use it when you're walking, any preventative exercises, essentially as a prophylactic as well. Another important feature is that the ActiPatch is the only therapy, electroceutical therapy, that is paresthesia free. So it does not result in any uncomfortable tingling sensations or numbing sensations and any other things that might irritate or aggravate the pain more. Now, harmful side effects. Now, pills obviously have some known long-term side effects. While TENS is relatively safe, the fact that you have to use electrodes on the skin and put electrode gel, that damages the skin if you use it repeatedly over time. I mean, if you ever touched a cable wire and got a shock, that's TENS. That's essentially TENS. It's pulsing electricity through the skin. Since ActiPatch uses electromagnetic fields, just like your cell phone, it can pass through skin without activating the sensory nerves, which means that there's no paresthesia. And as a result, there's no harmful side effects. It's also much more cost-effective compared to other technologies out there. If a person used on an average 4 devices, I'll walk you through in the next few slides what 4 devices translates to, but we're talking about an annual cost of about $120, which is very comparable to someone who pops, let's say, 2 ibuprofen or 2 acetaminophen a day. And we have been cleared by the FDA for some pain conditions recently, and we're available in Canada, and we've been approved for sale in Europe by the CE mark, and then even the Australian government for sale in their country. In summary, the ActiPatch is a non-invasive paresthesia electroceutical device. The key features are it delivers about 1,000 pulses a second, so it's very high frequency device, no harmful side effects, and it can actually be used over clothing, unlike any other electroceutical device. If you use it over, let's say, some bandaging, or if you like to put it on a t-shirt, that's certainly possible. Now, how does this neuromodulation mechanism work in mitigating chronic pain, especially since we've discussed central sensitization? Now, it turns out that the neuromodulatory effect can help with mitigating central sensitization. Now, the theory is that since afferent nerves are constantly firing these pain signals, even when there is no external threat of pain, the ActiPatch signal serves as a background noise, and over time, the sensitized afferent nerves habituate to the signal. The analogy I can provide is, let's say you put your coat on, and in about a few minutes you forget that your coat is on you, right? Because your system has habituated to it. Now, what if I keep jerking on that coat all the time? You're never going to forget that you're wearing the coat. That's essentially what the ActiPatch does, is it pulses the signal constantly so that the sensitized nerves are now tuned to this signal. And over a matter of a few days, which I'll explain to you in our clinical evidence, it tunes out its misfiring signals and focuses on this new information. And what this results is in reduced nerve firing, which what we see is as chronic pain relief. So in other words, by reducing these misfiring pain signals, we can provide patients with chronic pain relief. And the important thing is that ActiPatch reduces chronic pain at night as well, since it can be worn 24/7, meaning that people report being able to sleep better, move better, and as a result have an overall improvement in quality of life. Now, the ActiPatch can be used in multiple applications here, as you can see on the screen. I'll go clockwise. One common application is for osteoarthritis of the knee, where the person places the device over the knee and then wraps it up or uses bandages. And then commonly, it's used for tendinitis, especially the shoulder area, for repetitive injuries or any other injuries that might happen. As you can see, you just place the area of pain within that loop and then just bandage it on. And you can place it over light clothing or directly on the skin, whatever works best for your patient. Number 3 is our unique plantar fasciitis product, targeted towards the heel, obviously. But we have a miniature device that's embedded into a gel insole, much like a Dr. Scholl's insole. And this is something you can just slip in and wear in your shoe so that the therapy can be focused on the fascia, essentially. And then our most popular application is for low back pain that can result from bulging discs and a variety of conditions. But it can be taped on, or it can be placed on a wrap, and then the wrap can be worn comfortably. So these are the most common applications. Now, we've seen people use it for other conditions such as carpal tunnel, ankle sprains, and you get the idea. So just want to quickly walk you through the clinical evidence that we have, and essentially what we use to submit to the FDA, and what other data our Ian here, our clinical research director, collected for you. So just a quick overview of the clinical studies focusing on musculoskeletal pain. There were 3 main studies. One was a focus on knee osteoarthritis, the other one was a plantar fasciitis study, and the third was an acute pain study. As you can see, all the results I'm going to be talking about are statistically significant results. So these were clinically well performed. For knee osteoarthritis, important thing is it produces pain across the board. I mean, and we measured it using VAS scores and WOMAC scores, and we see an average 25% reduction, see a reduction in stiffness and inflammation as well. The most important and thrilling observation for us was subjects who used the ActiPatch actually report a reduction in the consumption of analgesics. In other words, we believe that when used as an adjunctive therapy, ActiPatch can actually reduce the medication use of people. And similarly, for our plantar fasciitis study, we saw a 40% decrease in the 7-day VAS score. And plantar fasciitis patients tell us that their pain is worse in the morning, right upon waking up, when when you put your foot on the ground. And that's what we used to measure it, and we found a statistically significant difference. The acute pain study is essentially another demonstration of relief for musculoskeletal pain. Now, this was for a breast augmentation study. So while we would consider that as a injured tissue, in effect, the pain was actually a result of the implant pressing against the pectoralis muscle. So it is considered to be a musculoskeletal injury condition. So that's our walkthrough of the clinical studies. Any specific questions, we will be more than happy to answer them towards the end for you guys. And importantly, Ian did a large real-world effectiveness study with the ActiPatch. So we know what the efficacy is in a clinical setting, but what about the effectiveness? And what our team was able to do was we collected data from about 15,000 subjects over a 3-year period, and we even got 2 publications out of it, and which we list at the bottom for anybody who's interested. And by the way, this presentation is going to be made available for physical download towards the end of the webinar, so you will have access to all this information. And what we did was we utilized a trial version of a regular device. The key point of which is you can turn it off and you can find out if it works for you, like if it can provide pain relief for you in a 7-day period. And 2 out of 3 users reported about a 57% reduction in pain. And more than, as expected, more than 70% reported sleeping better, about 75% reported increased physical activity, and as usual, our favorite observation, which was actually a surprise because we weren't actively tracking it, was about 65% of those who benefited from ActiPatch were able to have their medication use, including opioids. And we saw a corresponding decrease in the number of adverse events related to using analgesics long-term. And on the right-hand side is a table documenting the information that was published, specifically which conditions this was used for and what the corresponding efficacy is. And as you can see, we've used it on a wide variety of applications. Most common, obviously, is the musculoskeletal pain conditions. But this indicates that we have some solid real-world effectiveness data, and we'd be happy to discuss this with people at the end of the webinar. Now, how do we use the ActiPatch? Like if you were to try and tell your patients how to use it, or if somebody asked you how to use it, how do you use it? There's 2 steps really. In a package, you get the device, and then you get some materials that can help you put it on the body, like adhesives or wraps. So step number 1 is you activate the device by opening a tab on the back, and then you squeeze a little silver button. As you can see, it's right underneath the thumb on the top picture. And if you squeeze it for 2 seconds and flip it over, a green light should turn on, indicating that it's now ready to be used. And number 2 is how would you apply the device? You can use a wrap or bandages to secure the device to the body. In this picture, the gentleman has secured it to his shoulder region, or rather his trap region, using bandages. The important thing to remember is that the area of pain should be within the loop and not under